Hi, I'm Dr. Emily Bennett. I'm a consultant clinical psychologist and paediatric neuropsychologist, and I work at the Nottingham Children's Hospital. I'm also the chair of the National Acquired Brain Injury in Learning and Education Syndicate, known as ENABLES.
And I'm Dr. Gemma Costello. I'm an educational psychologist and the clinical lead for the Cambridge Centre for Paediatric Neuropsychological Rehabilitation, providing community rehab for children and young people across the east of England. I'm also a member of the ENABLES Steering Committee.
We wanted to provide a recording of the content of a presentation that will be shared for the All-Party Parliamentary Group for Acquired Brain Injuries Roundtable on ABI and Education tomorrow on the 25th of June. We will be joined on the day by a number of people with lived experience of acquired brain injury and their experiences within the school system. But for today, we were hoping to provide the core content so that those who are unable to make the meeting are able to catch up on everything that we want to share. So just to give you a bit of background, ENABLES are a group who are part of the UK Acquired Brain Injury Forum, and we are working closely with them to support the work of the All-Party Parliamentary Group on ABI. The vision for our group is for young people with an ABI to receive the support that they need and to maximise their participation and potential in education as a result. And really, we aim to work with policymakers, education professionals and other organisations to raise awareness of the support needed and the understanding needed for these young people with an ABI within education. So for those of you who may not know much about acquired brain injury or ABI, this is an umbrella term that we use to describe an illness or an injury to the brain that happens after a period of what is considered as typical development for that child. So the umbrella term can include traumatic injuries such as falls, assaults, road traffic accidents, sports injuries, and also concussions, which is a mild form of TBI. The term also encompasses non-traumatic injuries to the brain, which might be as a result of stroke, illnesses and infections such as encephalitis, meningitis, empyema, brain tumours, or other causes such as hypoxic events, near drowning, carbon monoxide poisoning, or cardiac events as well.
So in terms of the prevalence data, our current NHS England data estimates that there's roughly 40,000 children and young people who acquire a brain injury each year. We know that this is likely to be a huge underestimate due to the current methods of coding injuries upon admissions to hospital, but also because those with milder injuries such as concussion, as Emily mentioned, but also non-accidental injuries often don't present to hospital. The other key concern for us is that acquired brain injury itself is being recognised as a health inequality. We know that children and young people from socioeconomically deprived areas are up to 4 times more likely to acquire an injury, and particularly a traumatic brain injury. And it's an area, therefore, that we're recognising inequities for particular groups in terms of the support that they need in the longer term to be able to enable their ongoing potential. So there's a few important things for us to really hold in mind when we're thinking about childhood brain injury. Children's brains are not the same as adults. They are still developing with their new skills that come online as they grow. And of particular note are the kind of higher cognitive skills, which we know as executive functions, that have this real protracted development across adolescence and into adulthood. When we're speaking about acquired brain injury, we'll often refer to an example of an 8-year-old who has an injury to their frontal lobe. They manage well within a really protected and scaffolded environment of a primary school where they can control their impulses, they can sustain their attention, they can problem solve probably at a similar level to other children and young people of their own age with a lot of support from their teachers. But on their transition to secondary school, the demands increase, as we expect, with what we think about in terms of growing independence and brain development for children and young people. The scaffolds then fall away, and their needs become more evident in comparison to their peers. And the young person is then often seen to kind of grow into their needs. The challenge that young people also have is that from childhood brain injury, it has much more of a widespread impact across the brain, which means that we see greater difficulties in areas such as attention and processing speed, working memory, cognitive communication, social skills, and executive functioning. The other really significant challenge that ABI presents to children is that many will have a really good physical and motor recovery. And that means that they can therefore mask the hidden cognitive, social and emotional needs that can therefore have the potential to emerge over the course of their development. So there's lots of challenges for children when they're starting or returning to education after an acquired brain injury. We feel that there are these three key areas that are particularly going to be pertinent to the discussion in the roundtable event and that we hope we'll be able to explore together. These areas have been informed by literature, by service reviews, educators' experiences, and conversations with those that live with ABI. So we're going to bring your attention to these areas of insufficient data, training for teachers and SENCOs, and a need for timely provision for acquired needs in schools.
So first of all, thinking about data on childhood ABI or the lack of it within our UK schools, when we've looked at the prevalence figures, what we find is that this suggests that by the time a class have completed their time at school, the equivalent to one child per class will have experienced an ABI of some kind. So this is quite a large kind of prevalence figure and actually something that teachers and SENCOs and schools really need to know about. Unfortunately, what we find is that actually there is no data collected at all about acquired brain injury by schools, by local authorities, or by the DFE as a whole. So we have no idea about the actual numbers of children and young people within the education system who have a history of ABI. That's also the case within the SEN census, which is returned on a termly basis by SENCOs. There's actually no category for ABI at the moment. This means that SENCOs are forced to record children who have needs across all four broad areas of need under much more general categories such as moderate learning difficulty, perhaps social, emotional and mental health, or simply other. And this really underestimates the range of needs that children with ABI do present with. What we also find is that children and young people with an ABI often don't actually meet the criteria for SEN support. So then we completely lose them within the school system because there's no recorded information at all about their history of ABI. That results in their needs often being misunderstood and unsupported. And it also means that they end up being overrepresented and hidden within data elsewhere in the education system, such as pastoral data, attendance data, and exclusion data. So when we think about data, we really need to know a number of key kind of bits of information. So first of all, we need to know how many children and young people actually have an ABI or a history of ABI within our schools. We need to know how and where these young people with an ABI are being educated. We need to know how many of them are on the SENK list, how many have EHCPs, and how many aren't on any form of kind of registered support, and how we can then track all of these children and young people throughout their time in education so that we can respond to their presenting and emerging needs. So when we think about kind of our proposals for that data gathering, and this is something we'd like to explore within the roundtable discussions, what we were kind of wondering is whether on a national level we could perhaps look at adding an ABI category to the SEN census. This is similar to that that's happened with ASD and Down syndrome more recently. On a local level, local authorities could be asked to capture data from schools so that we know about the numbers of pupils with an ABI in the local area. And that would mean as well that schools would be required to ask for information about ABI in their school entry and annual health questionnaires.
So we know that there's limited rehabilitation for children in the UK, and while schools can't be everything to everyone, they are by their very nature excellent naturalistic rehabilitation settings. These are environments that young people either get to know and learn about themselves in terms of how they learn, or they may rediscover in a new way as they return to education following an injury. All of this, though, only works if teachers are provided with information about how the brain works and the things to be looking out for following an injury. So your briefing document will provide a bit of an overview of the negative outcomes that we often see associated with childhood brain injury, particularly when young people have been out of education. Current teacher and SENCO training has no information on acquired brain injury, yet its prevalence is reported to be similar to, if not higher, of autism spectrum conditions and ADHD, which teachers do have mandatory training on. If teachers don't have information on acquired brain injury, there's a real risk that young people may get labelled as having other types of conditions or other needs. Their needs can often be interpreted as being related to behaviour that's challenging, or associations or decisions may be made about the level of effort that that young person is giving to their education and performance. Assumptions might be made about their levels of mood or anxiety. And the risk is that sadly what this might lead to is an incorrect management and level of provision and support in order to be able to respond to those needs that are following the acquired injury itself. So in terms of what we need, we know that we need teachers and SENCOs to have training on acquired brain injury and to understand how to meet the needs of this group of young people. There are no current acquired brain injury policies and guidance in schools, so those would be fantastic to have. And that those who are professionals who are working within the local authority and SEND system could therefore have a minimum level of training on ABI. So our proposals are, as we've said, teacher training to include this basic level of information on children's brain development and what the potential impact can be on the course of a young person's development and their educational journey when they've had an acquired brain injury. We'd love for SENCOs to have mandatory training on acquired brain injury within the national qualification for SENCOs. For local authority, SEN and advisory services to have training on acquired brain injury. And we think this would be really helpful for those universal services as well. Think about specialist teachers, educational psychologists, and then SEND managers thinking about this decision making for this group. And then also for schools to be advised to include acquired brain injury as part of any CPD offer.
So our final point that we wanted to kind of discuss today at the round table is thinking about the need for timely provision for acquired needs within schools. So after an ABI, children and young people return to school with new needs that need to be urgently addressed to ensure that they don't have periods of extended absence or sort of experience increased isolation and bigger gaps than they need to in their learning and attainment. So many of our young people will go back to the school that they were in before their brain injury, but they will need to be supported in a different way. We know that there are very few pathways around the country that actually support this process of returning to school. Those that do exist work really well, but we need that to be something that exists more widely and not kind of the result of a postcode lottery as such. What we also know is that the SEND system and the funding routes associated with it are slow and inflexible. And this means that they are not designed to respond quickly to acquired needs, and in many cases prove inadequate for meeting the needs of young people after acquired brain injury. In particular, the graduated response that's required of many schools to evidence cycles of plan, do and review actually hinder access to much needed support and creates further inequality for the group. We know that some local authorities, once they have information, can fast track and can make these processes much more slick and much quicker and more able to meet needs on an appropriate level, but they really need to have policies and support to guide them in this way. The other thing that we're aware of is that we see that it's a minimum of 20 weeks to get an EHCP, an education, health and care plan. But currently we know that that's more like 40 or more weeks in many areas. And obviously in the face of acquired needs for a young person, that is completely inadequate for a very vulnerable group. So what do we need to think about in terms of kind of meeting those timely education provision needs? Well, the system really needs to have the capacity to respond to this sudden change in needs that we see after an ABI. We need to also make sure that local decision making around SEND status and funding is based on a child's individual changed needs rather than a comparison to others. And we need to think about how we can ensure there are pathways that support young people, their families and their schools to navigate the return to education after ABI. So how might that happen? Well, we could prioritise EHC and interim funding for children and young people after ABI. it would be really helpful for local authorities to have a policy about ABI where they can establish evidence that benchmarks that young person against their pre-injury skills rather than against routine developmental criteria. We also need to remove that requirement that often takes a long time for the plan do review cycles, when we know that there are required needs and that there's medical information available to support that. And we really need to establish those pathways for supporting the return to school to make this whole process much smoother and more successful for all of these young people.
So we hope to kind of end the roundtable event with some questions for further discussion. We want to kind of consider, how do we ensure that we have accurate data to know how many children, young people have an acquired brain injury in our schools, and how can we track their needs over time when we think about that ongoing brain development and children, young people growing into those needs like we've discussed. We want to think about how we might bring greater awareness to teachers and SENCOs so that they feel confident to understand the needs and meet the needs of this group of young people within our schools. And to think about how can we enable a more flexible and responsive system to those who sustain these acquired needs, so that we can provide resources at an earlier stage before it's too late. We thank you very much for taking the time to watch this video. We hope that you will be able to refer to our briefing document if you'd require any further information, and with details of how to get in touch if you have any further questions. Thank you.
Thank you.